Alright, good morning. I'm going to do an Ezpap, and so the first thing I would do is check the patient's chart, and when I'm ready, then I'll enter the room with the necessary supplies, and I'll introduce myself, check the patient's ID band, wash my hands, and then I'd apply the appropriate PPE, and then I would check the patient. So I'm going to check their vital signs, and I'm going to listen to their lungs, and then I'm going to explain what I'm going to be doing for them. So here's an Ezpap. So this is going to be connected to an oxygen source, so don't worry about that. It's going to help you clear out your lungs, and it's going to help us see how well you're doing. Here I have a pressure manometer here. And so this here is when you go to inhale and everything, I can see what you're set at. That way we can continue to practice with this to continue to open up your lungs. This will help you cough up any secretions that you may have in there. And this is like a positive pressure one. So this one is going to have positive pressure with your inspired and exhale. So you're just going to put your mouth around the mouthpiece, and you're going to breathe in and out. Just normally a nice deep breath in, exhale. Just kind of nice slow deep breaths in and out, okay? So when we're ready, I will prepare it. So if we need to measure with the manometer, so we apply it to the port, the smallest port here, right here. We'd make sure it's on tight. And then we would set it at the appropriate flow where we want them to be at. And so then when they go to breathe in and out, we can see with the red line here where it'll go. And then with this kind of thing, so this can also be going along with your nebulizer treatments. So the first thing I'm doing this time is just gonna see where you're at and just give you, continue to practice and strengthen your lungs to be able to cough up some of those secretions. So when I'm ready, I would plug this into an oxygen source over here. And then I would set it at least 5 liters per minute. And so I'd instruct the patient to hold it like this and not upside down, because then I want to get the appropriate reading. And then not to occlude the ending in part, because then I want to get that positive pressure flow in and out. And so then I'd have him hold it like this, do like a nice deep breath in, and then exhale for 3 to 4 seconds. So it's a 1 to 3, 1 to 4 ratio. And so we would do this about 10 to 20 minutes. We do a few times at a time, and then give them a break so that way they don't get overwhelmed, don't hyperventilate, anything like that. And so when I am done and they do their practice, I always have them do a nice deep cough. I'd have them cough up anything. And if they do cough up something, we can have a basin, or if the doctor needs a sputum sample, then I'd have them cough into a lab cup, and then I would have a label on that to label the sputum sample. But when I'm done, I would remove it from the oxygen source, shut off the oxygen source, then I would remove it. Then I'd set this in a safe area because we'll be using it again. And then the manometer here, this is disposable, so you can just dispose of this when you're done with it. And then if you're just doing the device, the Ezpap with the oxygen source without the manometer, then you take your cap and cover up that other hole so that way you don't get any other extra airflow. So when you're done with this, you'll instruct the patient to air dry it, not to wash it out, because it can mess with the clutter in there. So you just set it off to the side for when you do another treatment. And so after every treatment, I will reassess the patient, listen to the patient's lung sounds, and if they did cough up any secretions, to make sure I chart that down if it's a copious amount, if it has a distinct odor, anything like that. And I'd also check the vital signs, and when I'm ready to go, I'd remove my PPE, wash my hands, and then go and chart on the patient's chart that we did an Ezpap treatment with them.